is typically a 4-view routine x-ray. We do the AP oblique external rotation, and AP oblique medial rotation or internal rotation. And then we also do a lateral view. So to perform this, we have the patient sitting at the end of the table, and for the AP in both obliques, we're going to have the patient just extend the arm straight out instead of bending the elbow 90 degrees. The lateral, we will bend the elbow 90 degrees. It's really important that we want to raise this table up in height or lower the patient's chair down, because we want to try to get the shoulder and the elbow as close to the same plane as possible to get proper visualization and views of the anatomy. So again, 40-inch SID to the tabletop. We use a 10 by 12 cassette size. And if you're going to collimate to all 4 sides. Otherwise, we're going to use the DR plates that are 14 by 17, and we're just going to collimate to the anatomy. So for a true AP, you're going to extend that arm out, and we're going to center to the mid elbow, or where the elbow bends, which also happens to be just about 3/4 of an inch distal to the midpoint of the epicondyles. So midway between those epicondyles and about 3/4 of an inch distal. But if you bend your elbow, you essentially want to center right at the bend. So we'll kind of zoom this in just a little bit here so that you can see better views of how we would position that elbow up close. Alright, so centered from the top here looking down, what we're going to do is we're going to center mid elbow, and then we want to get about half of the humerus and half of the forearm here. We don't need very far up on there, but we're going to collimate. We won't have the entire length of that 10 by 12, and we'll collimate on the sides as well. Marker is going to be on the lateral side, and it should be out of the area of interest. So I'm going to move it around just a little bit more so you can kind of see what I mean by positioning here, and we'll switch it to the bone view. So if you look at this, it kind of zoomed in, you're centered right over that joint space. That's what we want to do. If we're centered up here on the humerus, it's going to close that joint off and we won't be able to see the joint space. If we're centered down here, same thing, it's going to close that joint. We want to be centered right over the top of it. We want to make sure that it's a true AP and the epicondyles aren't rotated at all and the radius and ulna aren't superimposed more than they should be. So this is what the x-ray would look like. So you can see the olecranon process here, the humerus coming down. You've got the radius and ulna. You should be able to see the radiotubercle will be a little bit superimposed over the ulna on this. On a true AP, this is what it's going to look like. They're not going to be separated. We separate them in one of the oblique views. So we'll go back to the regular view here. Alright, so there's where you want to center for your AP. I'm going to zoom around just a little bit more so you can kind of see that. The hand should be completely supinated or palm up so that you know that there's no rotation. Alright, we'll move on to the lateral oblique. So with the lateral oblique, usually what I tell my patient is, I want you to extend your arm out and then roll your thumb down so that it touches the table. It's kind of hard, and if you put your hand out straight right now and roll your thumb down, it's a little bit painful. So if patients can't do that, I always tell them, okay, that's fine, you don't have to do that. I just want you to lean your whole body back. And when you can kind of tell how she's leaned back. If they lean back, it's going to roll their thumb down anyways without actually just turning their thumb. You want to make sure that there is about a 45-degree oblique. So normally it's like kind of, you can see it here, it's kind of like a slide down of the anterior portion of the elbow. What we're trying to do right there is open up that space between the radius and ulna so we can see the radial tuberosity like I showed you on the last x-ray. So you can kind of see here how this side's up, the hand's up, the thumb's kind of pointing down. So again here, now you can see the difference. I'm going to go back just a little bit. So now you can see the separation here between the radius and ulna. You can see that radial tuberosity, and they're not separated. That's the point of the lateral oblique, is to open that up just a little bit. So we'll go into the medial oblique. So they do their medial obliques just a little bit different here than I do. Some facilities, instead of rolling the elbow back, they've actually got the palm kind of pointing up. Most facilities, you're just going to put the palm down, which is going to put them into a medial oblique. See how their palm is just up the opposite way? Like I said, a lot of them, they just put the hand down, so the palm's facing down, and then that's the medial oblique. Alright, so I'm going to move on to the lateral since the medial oblique isn't necessarily 100%. So on the lateral oblique, you want the elbow bent 90 degrees. The thumb is going to be pointing up so that the wrist is in a true lateral. That way the forearm, elbow, and everything is in a nice true lateral position. One of the most important things that you need to do on a lateral elbow is to ensure that the shoulder and the elbow are on the same plane. Because if the shoulder's a lot higher than the elbow, it's raising the humerus up, and then the joint space isn't going to be truly lateral. The epicondyles aren't going to be superimposed, the joint space isn't going to be open, and you're not going to get an adequate image. So if the table doesn't go up any farther or the chair doesn't go down any farther and they can't get their shoulder down, you can build this plate up, put things underneath it like sponges to raise it up so that they're on the same level. And I'll kind of move it around to the front so you can see what I mean by that too. Right here. See how the shoulder now is on the same level as the elbow. Now we just want to make sure that that shoulder isn't way up here and the elbow down here. They need to be on the same level. See how the thumb's pointing up? That hand's in a nice true lateral position as well. So for the central ray point, what you want to do is you want to center, oops, let me go back so you can see this for just a second. You want to center about 1.5 inches medial to the posterior surface of the olecranon process. So right about here is the olecranon process, or the pointy part of your elbow, right? You want to go directly in 1.5 inches medial to that. So on your elbow, if you bent it right now, find that olecranon process. You're going to come up and you'll feel bone. And as soon as you feel bone, it'll go to like kind of a little squishy part there. You want to center about right over that, where that bone and the squishy part meet. I know that's very technical terms, but that is your best area to center there. You want to ensure that your marker's in there, but it's not in the anatomy again as well. So this is why we want to make sure that we're centered right over that bony area right here. We want to ensure that this joint space is open, okay? So opening up here, and that the epicondyles of the elbow are superimposed over each other so that it doesn't close off that joint space. And as I zoom around here and kind of, you can see the difference. Let me move it a little bit. When I go to that posterior side of the elbow, you'll be able to see what I'm talking about. Okay, I'm going to pause it right there for a second. See how this elbow or the humerus is sitting right on top of each other? Imagine, if you will, if that shoulder kind of came up. What would happen, would put this a little bit more down here, and it would bring this back just a little bit. So they wouldn't be superimposed over each other, which would close off the joint space. So we want to make sure that everything's nice and in line so that the joint stays open. All right, we'll go back to the x-ray here in just a second. All right, so this is a good lateral x-ray of the elbow. So you've got everything kind of nice and superimposed over here. The joint's open. You can see the trochlea here. Olecranon process you can see. So this is a very good lateral elbow. All right, so that's it for the elbow views. I will stop that one right there.